Good afternoon. Welcome, and thank you for joining us here with Family Network on Disabilities. My name is Latasha Bird. I'll be your moderator today on behalf of the Family Start program, which stands for Support, Training, Assistance, and Resources. Family Start is the family to family health information center here for the state of Florida. The program assists families of children and youth with special health care needs, helps them to make informed decisions about their health care for their children with the STAR, support, training, assistance, and resources. See, our goal is to help families be effective partners in their healthcare decisions, making those decisions at all levels and report satisfactory with the services that they receive. So families are able to have thorough medical home and have access to comprehensive health and related services and have information that ensures that there's adequate public and or private financing of the services that they need. Also having access to community services that are organized so that families can use them easily and also receive those services and resources so that they can successfully transition to all aspects of adult healthcare work, care, and independence as well. We want you to sit back and enjoy this presentation. This is the first in a series of 4 on understanding how to parent a child with mental health needs. So today's webinar, remember, is first in a 4-part series on parenting a child with mental health needs. Today's webinar will be understanding your child's emotional development. Again, we want to say welcome. Thank you for joining us here today with Family Network on Disabilities. We are a family-driven and family-centered PTI, which stands for Parent Training and Information Center here in the state of Florida. We are a nonprofit 501c3. However, before we get into the body of the webinar, we want to make one distinct clarification. We do not act as attorneys or doctors or even mental health professionals, so the information that you get today cannot be deemed as interpreting the law or giving legal advice or either medical advice as well. However, what we do is to provide information and resources and the support that you may need to make informed decisions about your loved one, especially those who have special health care needs. So today's webinar, Understanding Your Child's Emotional Development, will be the first in a 4-part series. Session 2 will encompass the systems you'll engage to support your child and family. Session 3 will be being the best advocate for your child and family. And session 4 will be being the best you for your child and family. Let's go ahead and get started. With understanding your child's emotional development, these are one of the 5 major things that we will discuss within today's presentation. With number 1, understanding how your child develops emotionally. Number 2, learning what impacts a child's emotional development. Number 3, identifying how trauma can impact health, mental health, and even your family dynamic. Number 4, learning strategies to deal with your child's mental health diagnosis. And finally, number 5, recognizing the strengths and challenges of your family unit. So in thinking of how does your child develop emotionally, it really begins early in life. The ability to regulate one's own emotions and manage successful interactions with other people is key for later academic performance, their mental health as well, and even those social relationships which may arise. A child's capacity to regulate emotions develops in a complex interaction with his or her environment and ongoing mental, physical, and even social development. Experiences, they are embedded in the brain. And as young children develop, their early emotional experiences literally become the architecture of their young minds. The emotional health of young children is closely tied to those social and emotional characteristics of the environment which surrounds them and in which they live. And we now know that the differences in early childhood temperament, ranging from being extremely outgoing and adventurous to being painfully shy and really upset by anything new or unusual, are all grounded in one's biological makeup. Parents and caregivers, they play a very vital in almost the biggest role in social and emotional development because they offer the most consistent relationships for their children. Consistent experiences with family members, teachers, and other adults will they help children learn about relationships and explore those emotions and have predictable interactions. When we think of emotional intelligence and the impact that it has, this refers to the ability to identify and manage one's own emotions as well as the emotions of others. It helps to create bonding relationships. It's generally said to include at least three different skills, and those skills would be number one, emotional awareness or the ability to identify and name one's own emotions. Number two, the ability to harness those emotions and apply them to tasks like thinking and problem solving. And finally, number three, the ability to manage those emotions, which includes both regulating one's own emotions when necessary and helping others to do the same as well. So within this schematic that you see here, these are Erik Erikson's stages of psychosocial development. The slide shows these 8 stages of development according to Erikson. And in this schematic, you see the socialization process consisting of these 8 stages in a wheel, representing the 8 stages of man. His 8 stages of man, they're formulated not through experimental work, but through a wide-ranging experiences in psychotherapy, which will include extensive experience with children and adolescents from low as well as upper and middle social classes. So let's talk about these 8 stages. Number one, being infancy. You see here, this period of infancy is through the first 1 or 2 years of life. The child, well handled, well nurtured, loved, develops trust and security and basic optimism. Badly handled, he becomes insecure and mistrustful, leading to early childhood. This is the second psychosocial stage. It's probably between 18 months or 2 years or so, and between 3.5 and 4 years of age. And it leads to that term of being a quote unquote well-parented child. Emerges from this stage and he would be sure of himself, elated with his newfound control and proud rather than ashamed. Say, for instance, you can use the example of being potty trained, being proud of learning a new skill. That leads to the third stage, which would be preschool. Erikson believes that this third psychosocial stage occurs during what he calls the play age or the latter preschool years. And during this stage, a healthy developing child will learn to imagine, to broaden his skills through active play of all sorts and includes a fantasy or pretend play as well. He learns to cooperate well with others, learns to lead as well as to follow. And immobilized by guilt, he's also fearful, understanding how those emotions start and develop, and they haven't fully learned how to process them. Also continues to depend unduly on adults and is restricted both in the development of play skills and imagination. So there's the one hand where a child has healthy developing, and then on the other hand, the child is immobilized by guilt in that development. This leads to the fourth stage, which is school age. So within this fourth stage, he believes that this is what is presumably up to and possibly including some middle school as well. Now, here the child will learn how to master more formal skills in life, which could also include relating with peers according to rules, processing from free play to play that may be more elaborately structured with rules and may define formal teamwork of sorts, such as team sport, like maybe baseball or basketball. And also mastering social skills as well, social studies, reading, arithmetic, and the like. That leads to the fifth stage, which would be adolescence. Now, during this fifth stage, from about 13 or 14 or so up to about 20, the child, which is now an adolescent, learns how to answer satisfactorily and happily to the question of, well, who am I? But even the best and most well-adjusted adolescents can still experience some form of confusion within this stage. That leads us to the sixth stage, which is young adulthood. At this time, a successful young adult for the first time can experience true intimacy. And that sort of intimacy makes possible for good marriages and good, genuine, enduring relationships as well, and friendships. That leads to 7, which is middle adulthood. And in this stage, it demands awareness of others in their well-being, both in the sense of marriage and parenthood, and also in the sense of working productively and creatively. And that leads us finally to our 8th stage, which is maturity. And in the other 7, a psychosocial crisis may have successfully resolved, the mature adult will develop that peak adjustment, that peak integrity. With all of the 8 stages here represented on this schematic for psychosocial development. What impacts a child's emotional development? Well, we want to think there are many factors that will affect the way a child expresses their social skills and the way that they express emotional competencies as well, or at the rate at which children acquire those social skills or emotional competencies. Those factors are going to look like this. The first years last a lifetime. What happens in the first years of life is directly related to a child's long-term cognitive, emotional, and social outcomes throughout adulthood. Number 2, environmental risk factors, such as living in an unsafe community, exposure to violence, receiving care within a low-quality childcare setting, or even lacking resources available in the community, or lacking policy supporting children and family. Those are all environmental risk factors. How about risk factors within the family itself, including maternal depression, mental illness in the family, parental substance abuse and violence within families, poverty, divorce, tragedies, deaths in the family, even job loss or severe parental discord, family involvement with the justice system, and even economic hardships, abuse, and neglect could all be family risk factors. There are inherent factors as well, such as a fussy temperament or even having a developmental delay, learning disabilities, and serious medical or health issues and identity questioning as well, which leads to the final factor, which would be social factors. This can include bullying, social media, experimentation with substances such as drugs and alcohol, or either dependency on video games, having community tragedies, or even exposure to violence. These can all be factors which would impact a child's emotional development. Now here, there's early childhood mental health video located right here on YouTube. If you would like, we'll put the comments, we will put that link in the comment section so that you can view the video at a later time. However, for purposes of time and integrity, we'll go ahead with the continuation of the presentation. But should you like to review the video that is located right here on your screen, please check the comment section. or at the description at the top of today's video. Let's talk about the Adverse Childhood Experience Study. That's ACE, ACE. That's what it stands for, Adverse Childhood Experience. Now, with this study, it's one of the largest investigations ever conducted to assess associations between mistreatment in childhood to later life health and well-being. The study had its origins in an obesity clinic in San Diego in 1985. And the doctors which conducted it were Dr. Vincent Felitti, chief of Kaiser Permanente's Revolutionary Department of Preventive Medicine. He couldn't figure out why more than half of the people in his obesity clinic dropped out, even after successfully losing weight. So after questioning hundreds of patients on their weight and what their eating habits were, he stumbled across a curious response from a candidate that changed the way he looked at obesity and eventually lifetime experiences. So he was running through yet another series of questions in that program. How much did you weigh when you were born? How much you weighed when you first started first grade? How much did you weigh when you entered high school? And one of the questions, he misspoke and asked, how much did you weigh when you were first sexually active? Instead of, how old were you when you were first sexually active? And the patient, who was a woman, she answered 40 pounds. He didn't understand what he was hearing, so he asked the question again. She gave the same answer and burst into tears and added, it was when I was 4 years old with my father. And then the doctor realized that he was dealing with the consequences of a traumatic lifetime event, not a problem with weight or obesity. So more than 17,000 home maintenance organizations, which is, as you know, is an HMO, more than 17,000 members over a 10-year period underwent that comprehensive physical examination and chose to provide detailed information about their childhood experience of abuse, neglect, and family dysfunction. Now, the ACE study findings suggest that certain experiences are major risk factors for the leading causes of illness and even death, as well as poor quality of life here in the US. So the ACE screening tool is it's very simple. It's a simple 10-question survey directly asking about emotional and physical abuse in childhood years. And the questions address these following topics: the lack of nurturance or support and emotional neglect, hunger or physical neglect, and the lack of protection or even homelessness, whether there had been a divorce in the home, whether there was alcohol or drug use in the home, whether or not there was mental illness or attempted suicide among household members, and also that there was incarceration of a household member. So if you had a score of 4 or higher, that correlated with mental health disorders, substance abuse, early criminal behavior, and even long-time physical health problems, such as heart disease, cancer, and even early death. So as we discussed in the previous slide, early childhood trauma has severe consequences in the developmental stages of childhood. Now, studies have shown that the consequences are far-reaching, very far-reaching and long-lasting. The effects can be seen in all areas of life. And because the body itself has been impacted on a cellular level, which is known as epigenetic changes, we see vulnerability in physical health, such as more injuries, more chronic infections, and even autoimmune disorders such as HIV, and more chronic diseases such as cancer, diabetes, and even heart disease. There are emotional impacts that are seen in areas such as mental health, and engaging in risky behaviors or even poor decision-making. And also the loss of economic or educational opportunities due to these emotional impacts. Now, with mental illness in children and adolescents, it's not uncommon. And according to NAMI, which is the National Mental Health Association, they have compiled some statistics about mental illness in children and adolescents. I had some of these here to this presentation. 12 million children under the age of 18 have mental disorders. 1 in 5 young people at any given time have mental health problems that affect them. 2/3 of young people with mental health problems are not receiving the help they need. 25 years shorter lifespan for those with untreated or poorly managed mental health challenges. Here are a few more statistics. 50% is the dropout rate for high school students with a mental illness. 17% of high school students had seriously considered suicide in 2017. The second leading cause of death for 15 to 24-year-olds is suicide. And the sixth leading cause of death for 5 to 15-year-olds. Yes, I did say 5-year-olds. So as many as 1 in every 33 children may be depressed. Depression in adolescents may be as high as 1 in 8. Schizophrenia, although it be rare in children under age 12, still occurs in about 3 of every 1,000 adolescents. These go to show that mental illness in children and adolescents is a growing issue, especially socially, mentally, developmentally, emotionally, all of these ways that we try to bring information to you so that you understand the sincerity of the situation and reach out to find the resources that you may need. These are one of the ways that you can find strategies, understanding how to deal with your child's mental health diagnosis. So according to the National Institutes of Health, a mental illness is defined as a health condition that changes a person's thinking, their feelings, or behaviors, or even all three, and causes the person distress and difficulty in function. You want to consult with a mental health professional and learn about your child's specific diagnosis, and learn about what those symptoms look like and how they can manifest differently in your child. Understanding how to process the diagnosis, and remember that your child is your child first, not the diagnosis. Remember that there are valuable qualities within your child, and see their illness is only one part of the whole identity. Processing your child's diagnosis, it will help you be better equipped in how to respond to it. So you want to try to be aware of any preconceived notions that you may have that come into play when working through those situations and certain issues. And understanding that your child's mental illness is not a consequence of your parenting, but a condition of how their brain is wired. Getting the support you need by gathering a solid team of specialists, getting support for the whole family, because when one member struggles with mental illness, the whole family is essentially affected. We want caregivers to understand that you must take care of yourself. By investing that time to help yourself, you're better at helping your child. And also, should you need to find support in a group, find one, either in person or online, with a chat room or face-to-face, but find the resources that you would need and the support that you would need, and not fearing at the beginning of mental health issues that is the end and the finality of having a happy and healthy life. Search on the internet, search in the library, ask friends, speak to other families in similar situations. But at all times, you want to give yourself the time that you would need. There is a huge learning curve. You may have to step back at times and even ask yourself, what was the result of my child's mental illness? And is this a result of their natural response to frustration? And remember, it's important to pick your battles, decide what's harmful behavior versus what is actually just annoying behavior before you respond to those behavior. And at all times, be able to forgive yourself. Give yourself some grace and the time that you would need to be able to process. You want to recognize those strengths and challenges in your child and in your family. Have a conversation about reframing problems, and looking at behaviors and looking at attitudes that could benefit your child. Looking on the left, you see what are the strengths? How can we use them to better our situation? What is your child good at? What do they enjoy doing? And what types of skills do they have that are useful for now and even at a later time? Now, on the other side, you want to think of what those challenges look like. Challenges are not necessarily problems. They're opportunities for growth. It allows for open thinking and encouraging those problem-solving skills, develop planning skills as well, encouraging solutions, being able to work together for an end result. We want to think in terms of what the strengths are, what the challenges are, and how you can incorporate the tools and resources necessary for both sides. Here's an activity for you. Recognize what you bring to the table. What are your strengths? What are your knowledge? What knowledge do you possess? What type of cultural perspective comes to mind when facing these issues and challenges? What type of connections and relationships do you have? And what can further your insight on your child and family? So think of it this way. Give yourself 5 minutes to recognize what you bring to the table. List your child's and your family's strengths on a blank piece of paper, and we'll come back and discuss some of those. So now would be a good time to stop your video, give yourself 5 minutes, and identify those child and family strengths. We'll see you in 5 minutes. Now that you've completed the activity, how about offering some of the activities that you were able to list? How does it look in a global sense? How many items did you list? Understanding what and recognizing what it is that you bring to the table can help you with your knowledge of your child's illness, help you with understanding where you are as a caregiver, and also helping to understand where you would need to find more resources and find the support that you would need on that continuum of learning and growth, and finding all of the information that would assist you with making those informed decisions about your loved ones. Thank you so much for joining us here today with Family Star, which stands for Support, Training, Assistance, and Resources within our regional program umbrella held by Family Network on Disabilities. We invite you to join us on our social media channels as well as our website, www.fndusa.org. And should you need any further assistance, FND is here to help. You can reach us at 1-800-825-5736. Again, that number is 1-800-825-5736. And with that, we want to say thank you so much for joining us here today for understanding your child's mental health needs. It has been a pleasure. We would like to invite you to visit our vast web repertoire of informative webinars, and especially use this time to navigate and find which one of these webinars works well for you, especially understanding how to parent a child with mental health needs. There are 4 in this series. This is the first, with understanding your child's emotional development. Please, should you need to reach out to the Family Network on Disabilities, we are here to help. use our email address to direct message us as well, or even by phone. At F&D, we are here to help. Thank you so much. Will join us at a later time for part 2 in this 4-part series. And should remember, if you would need us for any support or resources, we are only a call away. Thanks so much. We talk to you soon. Bye-bye, everyone.